response. But what I wanted to talk to you about was just kind of our local plans. And last spring, about this time, April or so, I made the rounds pretty much in every county, kind of giving a very similar talk in terms of a brief. So some of you, this may sound familiar. If your memory is better than mine, then you can remember a full year. But anyway, what we are planning in terms of environmental response here locally has several different key focus areas. The first one, which is very important, is our education and awareness. So as mosquito season spins up, you will be seeing messages from the health department. Abby helps a lot with our social media area. We'll be doing press releases. Last year we got a couple of cable access networks to do infomercials, little 3 or 4 minute commercials on how to protect yourself against mosquitoes. So you'll see this publicity push again. Nuisance complaint investigations, which is where the health department actually receives a complaint about my neighbor's green swimming pool or abandoned goldfish pond. These are the types of things that we respond to on a normal basis anyway. But we're going to have a point of emphasis, especially with mosquito complaints because of the threat of Zika and other vector-borne illnesses. Larvicide, which is a product that you can put in standing water to prevent mosquitoes from breeding. I'll talk a little bit about what we're doing with that. We coordinate with local and state adulticide applicators, people that are doing mosquito spraying in the communities already. We're doing mosquito surveillance, supporting the Kentucky Department for Public Health and University of Kentucky in trying to get more data and look at actually what the makeup of the mosquito populations are and actually do testing for Zika virus and other vector-borne illnesses in our local region. And then finally, what Brooke alluded to is an environmental response if we have a PCR positive case or we have a travel acquired case, or if we have any type of acquired case where the person is viremic and could possibly transmit it to local mosquitoes and then on to other people in our population. So those are the key points, and I'll go into a little bit more detail on each of those. So Brooke talked a little bit about the mosquito vectors that we're concerned about with Zika. This is one of those slides I recycled from last year, but the one on top is the Aedes aegypti. That is the mosquito species that is most associated with the transmission of Zika. If you see in the shaded blue area of the United States, we are within the range of that mosquito. However, we don't see that many of those in the surveillance that we do. They're more common in heavier populated areas. And then the other reason why we probably don't see as many of them is they're outcompeted by the mosquito on the bottom there, which is the Aedes albopictus, and we see all kinds of these. That mosquito, I guess, moved into Kentucky in the late 80s. It's now very common, and it's, go back to your old ecology days in school, it's outcompeting the Aedes aegypti, so we see a lot more of those than we do of the, so we see a lot more of Aedes albopictus than we see of Aedes aegypti. It's an aggressive day biter. It's a small black and white mosquito. It stings when it bites you, so if you're out in your yard in the middle of the day and you're getting eaten alive, chances are that it may be this mosquito. They like to breed in containers around homes, clogged gutters, and they're like I said, they're very common and they're widely distributed in the state. It's thought that they can transmit Zika. It's just not, I guess, fully understood about how efficient they are at transmitting the virus. So our educational awareness campaign will kind of focus on the things that Brooke already touched on, is protecting yourself against mosquito bites, wearing, staying indoors, when you're outside, making sure that you're wearing an approved insect repellent. Our slogan is drain, defend, and dress. So it's dress in long sleeves and in long pants, dress appropriately for where you're going to be. Defend yourself with insecticide, or not insecticide, but insect repellent, and then drain. So you want to get rid of standing water around your home or wherever you're going to be to cut down on the breeding of mosquitoes. And then also we're going with the slogan, fight the bite day and night, just to try to keep mosquito awareness in the forefront of people's minds. So our nuisance complaints, these are the types of things that we see when we get calls. It's usually sometimes the next door swimming pool that's been abandoned. Sometimes the house is in foreclosure and we can't find an owner to take care of that and to make it, to remediate it and drain it. Old tires laying around, junk jars that'll hold water, your saucers around your flower pots. All of these are highly effective in terms of breeding Aedes mosquitoes. So when we get complaints about the neighbors that are causing a mosquito problem, typically an environmentalist will go out, they'll do a survey or a site visit, they'll try to identify what potential sources are, and then they'll have the property owner take care of those. If there's not a property owner to take care of those, we do the best that we can. Sometimes we may use a larvicide product to treat a swimming pool, an abandoned swimming pool. If it's a wheelbarrow that's full of water, we'll dump it out and turn it upside down so that it can't collect water. If it's a tire, those are harder to get rid of a lot of times, but we'll make some calls and see what we can do. Or at the very least, we'll try to put some larvicide in them or empty the water out that's already there. So I mentioned larvicide last year. We had some funding where we were able to actually purchase larvicide. We applied this a couple of different ways. One way was that we repackaged it and then provided to homeowners that had areas that weren't easily drained so that they could treat their own area. It's not a restricted use pesticide, so it's fine for a homeowner to treat their own property with it. And then we had a couple of people licensed that could actually go out and do application of this for situations where we got contacted by the local government, or we came across a situation when we were doing a nuisance complaint that really needed to be larvicide and there was no other resource to do that. We were going to try to purchase more of that this year. We didn't advertise that because this stuff's pretty expensive and it doesn't go a long way. But we're actually, this year, there's a new product out that's over here on the left-hand side. It comes in a residential consumer-friendly pack. And it just looks like a little blister pack with pills. As you can see there, each of those pills will treat like a 50-gallon barrel of water. So that's perfect for some of these wheelbarrows, tires, these abandoned small goldfish ponds that no longer have fish in them that are going to keep the mosquito population down. So this will be something that we can, when we run across a homeowner or a situation where someone doesn't have the resources to get larvicide on their own, that we can actually provide. Again, we're not going to heavily advertise that because if we did, we would have people wanting this that don't even necessarily need it, and we would run out pretty early. But for you all, if you run across situations in the community, if you refer those to us, then this is a resource that we'll be able to provide. Every county is a little different, but there's a number of programs already in existence for local spraying. So this is what you may see if you're up at 3 in the morning and when the spray truck goes by. It's just a pickup truck with a spray unit in the back. The health department interacts with these different programs in different ways depending on the county. Henderson, Hancock, Union, the local health taxing district actually purchases product and supplies that to the county government to augment their spraying areas. Here in Davis County, both the county and the city of Owensboro have historically contracted with private companies to do spraying. And then statewide, the Kentucky Department for Agriculture has a mosquito spraying program. So the combination of these different resources, if we get complaints or we find problem areas, we'll typically refer and talk to and try to not duplicate services, but make sure we can try to get areas covered and sprayed as needed. And so the way that we basically do that is, with the Department of Agriculture, we'll actually collect all of the complaints and kind of compile a list of areas that need to be sprayed, and then we send that on to the Department of Agriculture, and they'll get that scheduled in terms of their spraying. The last couple of years, they've been pretty transparent about that. They post a schedule on their website, so it's easy to kind of figure out when they've been in your county and when you can expect them back. And then with the local programs, it's just kind of ad hoc as needed. We'll we'll try to get areas covered. A lot of local programs will also kind of do some proactive spraying if there's going to be an event in a park, or if they have, you know, the 4th of July fireworks, they'll go ahead and spray those areas where they know a lot of people are going to be gathered. And then we're also doing mosquito surveillance. And so we have done this on and off over the years. We did a lot of mosquito surveillance back in the early 2000s when we had West Nile virus. Last year, kind of late in the season, we started working with University of Kentucky to collect mosquitoes, and to really at that point just looking at species and numbers. But this year there's going to be a more concerted effort to try to get surveillance statewide. We're going to participate in that. So we will actually weekly be capturing mosquitoes. We will package those up, overnight them to one of 3 labs in the state where they will be sorted and speciated, and then they're going to do testing for Zika, dengue, chikungunya, and eastern equine encephalitis. And is there any others? Okay. So, you know, we'll be looking for vector-borne illnesses in actual local mosquitoes. So a couple of traps here. The 2 on the left are the ones that we've used in the past. They all are really kind of designed to collect different types of mosquitoes. The one on the far left is called a rabbit trap. It's designed to collect the pregnant females as they lay their eggs. The one in the middle is the CDC light trap. It uses light as an attractant, and then we also augment that with dry ice, so the carbon dioxide, which is what mosquitoes are attracted to or how they hunt people, will be captured by a fan. There's a little light with a fan that blows them into the net there. And then the one on the right is what I'm hoping to get, so I'm lobbying since Brooke is here. I don't know if she has any pull or not with the state, but these are sentinel traps. They're supposed to be designed to be a little bit more efficient in terms of they don't chop the mosquitoes up quite as bad, so they're easier to test for virus. They're also more expensive. Last year we tried to order a couple and they were all out of stock. And then I mentioned before that the Aedes aegypti are not as common in this area. Apparently this trap is a lot more efficient at catching Aedes aegypti, so perhaps if we have the right gear, we'll see more of that species. So we are probably going to do most of that trapping in Davis County, but depending on what happens through the summer, we may move those sites around. Okay, so how do we respond to PCR positive cases? We have a multiple choice test, and it's going to be all of the above. You know, we will do the public awareness, we'll do the environmental scans. You know, we'll definitely coordinate with the programs that are doing spraying for adults. And then this year, kind of the new part of the plan is we are going to actually attempt to do perimeter treatments on properties where positive cases live and then surrounding areas to knock the mosquito population down to, in essence, protect our mosquito population from the viremic patient. And so that's the picture of the fellow there with the backpack mister. I don't know if some of the companies, the private pest control companies that are doing property treatments for mosquitoes, Mosquito Joe is one that you see, and there's 3 or 4 of these franchise type companies that do this. This is the type of equipment that they use. And so you may have seen that before, but the health department's actually gotten 3 employees at this point that are licensed now to do this treatment. All of those have sit through at least a training or presentation on how to do this perimeter treatment, and then there's going to be additional training offered later in the spring, so that we'll have everybody kind of checked out and had their hands actually on the equipment and have you know, practiced this before we're going out and doing the treatment for real. If we have a positive PCR case, in addition to the coordination of the spraying and the awareness, we will have environmentalists actually visit those sites and surrounding properties and try to identify areas where mosquitoes are breeding. This wouldn't be a typical nuisance complaint where we're going to go and cite someone to get a problem corrected, although I guess we could do that if we thought that was the best route. But really the purpose of these visits are to find a problem and take care of it, eliminate the breeding site, to try to knock the mosquito population down around where we think positive cases are. We've got a door hanger, which is logoed up with the fight the bite and the message about drain, dress, and defend. We could use these in a neighborhood. Last year when we kind of went through the plan, we were talking about patient privacy concerns. And kind of my preliminary plan then was that if we had cases, that we would have the environmentalists do these real intensive site scans immediately around the area, but to kind of shield so that we wouldn't have a bunch of health department activity in one area where everyone would figure out that there's a case there. We would do kind of a broader education campaign where we're doing the door hangers and trying to spread the message. Just that, you know, we're concerned about mosquitoes and the fact that they can spread disease and not isolate in on any one individual. So, in full disclosure, shamelessly stole all of these next slides off of the internet this morning and screenshotted, but these all came from Dr. Grayson Brown with the University of Kentucky. Just to kind of explain the thought process behind this perimeter treatment and why we think that this is a good approach. The way that mosquitoes hunt us is that we put off a plume of carbon dioxide here. So you have this nice family hanging out in their well-landscaped backyard, mature bushes, looks very nice. The wind's blowing over here to your left, or from your right to your left, and it's putting off a plume of carbon dioxide. And we've got a mosquito resting over here at the top of the bushes who picks up this scent, and then he's going to zoom right in over here and take or she is, I guess, the females are the ones that bite, and take a blood meal. But they're not going to make a direct line. That's not how they operate. That's not how they fly. If you saw Dr. Brown give this presentation, he's got a really nice animated thing, but when you steal his slides off the internet without his permission, you don't get that advantage. You can skip the screenshot. So the mosquito is going to hop from this bush to over here to this plant, over to here. And so it's going to kind of make 2 or 3 little pit stops on its way to feed on the family. So the idea with this perimeter treatment is that we can apply residual pesticide to the vegetation, cool, moist areas on the property, that when the mosquito lands there, they're going to get a dose of this insecticide, and then it's going to kill them. So the goal is for us to treat daytime resting areas for mosquitoes. The process that we'll use is we'll start at the house with a back to the house, up against the house, and then using the mister, we'll treat down in bushes, vegetation, under porches, areas where mosquitoes are going to rest and hide. And just the agitation and I guess the velocity of the mist coming out of this thing is going to flush them out, and then it's going to leave behind this residual pesticide. And so we'll start at the house, work our way out. We'll treat vegetation around the home, and then work our way out to the perimeter of the property and then treat that vegetation. Again, the objective is to treat any location that's dark, cool, or moist. The product that we're going to be using, there's a couple of different brands, but it's I guess the least expensive that we're considering has a 30-day residual. Some of them have up to like a 90-day or above residual treatment. And Dr. Brown has some really good data. UK has done a lot of testing on this process, and really, I guess, kind of developed it some. And they've actually gone in, tested this at sites where they're tracking mosquitoes post and after, and so you can look at the reductions in the population that they're seeing. And even with just using like a water, no insecticide in the backpack sprayer, they do see some reduction in the mosquito population because you're physically agitating them and flushing them out of the area. They'll eventually come back, and so that's why the residual pesticide is important. But that's how we're going to do it. So what we're going to do, I took a couple of screenshots of my neighborhood and to kind of explain how we're going to select the sites. The homes in blue would be, let's say we had a PCR positive case that lived there, then we're going to treat that home and then treat adjacent properties. So just by virtue of the street, you'll have some barrier there. So if it happened to be this home, we're only really going to have to treat 3 properties. Over here, where the properties are laid out a little differently, so you had a case here, we're going to treat that property, the properties on either side of it, the properties immediately behind it, and then treat the backyards of the properties that are catty-corner to it. So, and then this is all in addition to having the area sprayed with the truck sprayers and the environmental scans to look for breeding sites, and the public awareness campaign of people draining, mosquito breeding areas in their homes or around their homes, and then protecting themselves with insect repellent. So one thing that we're really concerned about with this plan, we think that the science is good on it. We think that it should be an effective process to help protect the community from a travel-acquired case or an isolated case. But we are concerned about privacy. This is going to be quite a bit of activity, and we don't want to bring attention or give people a reason not to cooperate. Some of that, I guess, is going to be a little bit unavoidable. So I think the legal opinion on this, and this is the last I heard coming out of Frankfurt, was that as long as we don't disclose a person's identity and we confirm that, yes, they are PCR positive, that we haven't breached HIPAA. Yet all of this activity, people may be able to kind of figure that out or figure out something's going on. So we're in the process of kind of developing talking points, ways that we can talk to the individual case and neighboring property owners to advocate for allowing us to treat, to get their permission, but at the same time not really compromising anybody's personal privacy. And depending on where you end up or who you're dealing with, that may or may not be that difficult. A lot of people may be pretty understanding of, oh yes, my neighbor took a Caribbean cruise, and so we're concerned about Zika, and so yes, I'll let folks on my property to apply this pesticide. One of the things that I was looking at was contacting some of the private companies that do this type of spraying and getting prices on what one of this treatment was. And so I'm going to say, hey, we're giving you a top of the line perimeter treatment for mosquitoes. It would have cost you $125, and we're going to do it for free. So we're just trying to kind of develop how we're going to approach that, how we're going to address that. And then the other approach, like we were talking about, we were going to do last year, is there'll just be a general information push across county or a district, and so hopefully, not necessarily to disguise our activity, but if we have a whole lot of activity in terms of mosquito awareness, perhaps that won't bring as much attention to one area when we're actually doing the door-to-door or doing the spraying. We probably won't roll up in full health department gear with health department raid jackets on or anything like that, but really kind of more of just trying to talk to folks, explain what we're doing, be transparent about it, but not try to bring any undue publicity to us. So that's my contact information, and if anyone had any questions, I'll be happy to answer them.